Morning, good afternoon, good evening, wherever you are. Uh, really delighted and it's a pleasure to welcome you all to the Indegene Digital Summit of 2020. Thank you all for joining. At the very outset, I hope all of you and your loved ones are safe and healthy. While we would have loved to have you do this in person, etc., I guess there is a silver lining to this after all, because we've been truly able to make this into a global summit with almost 2,000 odd pharmaceutical as well as life sciences professionals joining us from across the world. Further, it is perhaps appropriate that we're doing this virtually. After all, this is a digital summit. My name is Sanjay Parikh, and I have the unique privilege of kicking off this year's digital summit by hosting the first of our keynote sessions, which promises to be a really exciting one. I'm therefore really excited to welcome Dr. Sebastian Guth, as well as Brian Cantwell, because it gives us a unique opportunity to hear about digital transformation from two very different vantage points, that of the business leadership on the one hand, and of the digital change as well as practitioner kind of view from the other side. So let me introduce my guests to you. Sebastian Guth has held several of the senior most positions in some key markets for Bayer Pharmaceuticals worldwide. He was in Japan, Turkey, and is now in the United States. He's currently the president of the Americas for Bayer Pharma and has transformed the organization with a deep focus on purpose-driven results. However, if you were to ask Sebastian what is one of his greatest accomplishments, I have a feeling he will acknowledge that it is raising 3 boys under the age of 13. So welcome, Sebastian. It's a pleasure to have you on board. Brian Cantwell joins Bayer from Biogen, where he built a large and successful digital team from the ground up within the United States organization of Biogen. And incidentally, he joined Bayer during the lockdown, so that's got to have been a very unique experience in itself. And although he studied history at his alma mater, which was Harvard, he's made a career out of bringing the future to life. And therefore, joining a 150-year-old company with a storied history of Bayer was too good of an opportunity to pass up. He's currently the head of digital strategy and operations for Bayer Pharma in the United States, where he is building a dedicated digital team to enhance digital capabilities, to optimize brands, and to find new ways to connect with customers. So welcome on board, Brian. Delightful to have you. This year, it's interesting. I mean, instead of a keynote address by either one of my guests, we've chosen a more interactive format of a question and answer chat kind of session, during which Sebastian and Brian will help us understand the imperatives and need for urgency of digital transformation. So after the first 45 minutes or so of the session, we will take questions from the audience. Unfortunately, due to a scheduling conflict, Sebastian will not be available for the Q&A session afterwards. And hence, I would request that you please post your questions in the chat window directed only at Brian. So let's get started. So Brian, I'm going to start with you. I referred to this earlier. You have undergone and are perhaps still undergoing one of the most surreal experiences of our times. That is, start a new job during the pandemic where you don't get to meet your colleagues, your team members in person for months, but are still expected to hit the ground running and start delivering. I'm sure Sebastian expects that of you and everybody else in the organization does. So how has that experience been? Let's kick this discussion off with that.
Sure. Well, thank you, Sanjay, and first and foremost, just thank you to you and to the Indegene team for having us. I'm really excited to participate in this forum, and like you said, these types of events are often a highlight of the year for many of us when we can come together physically. But the fact that we're able to have so much more reach via digital and have so many more people participate across the globe in this format is also kind of equally exciting. So, but you hit it. This has been an interesting time for all of us. And for me personally, it's been a very interesting time to change jobs, change employers in the midst of this pandemic. And I'll say that maybe surprisingly, it's actually been a wonderful experience, that transition. I was very surprised during the interview process how well these types of modalities of interacting over Zoom or Teams or whatever video conferencing tool you choose, I was able to really build great relationships with and connect with members of the Bear team. And that really made me feel welcome, and it's continued through to me getting started. So I think that, maybe one silver lining of this horrible pandemic situation we're in is we're adopting these sorts of tools and modalities. And for a digital practitioner like myself, there's a whole new sense of urgency and support for the type of work that I do, which is really, frankly, invigorating and exciting to be a part of.
That's great. I've heard that from others as well in terms of the receptiveness to a new way of working, new ways of doing things. But Sebastian, you're a people's person. You've always been. And for you, this has got to have been a strange experience as well. So how has it been like to work from home? Tell us a little bit about your new office.
Oh, Sanjay, first, again, thank you for having us. It's a privilege to join this summit today. Honestly, for me, it has been a genuine adjustment. As you said, I'm a people person. I really strive on the ability to connect with individuals. And I had to, in many ways, rework my own practices. What I've come to realize is that it really affords me and us the opportunity to, in fact, connect with many more people than I would otherwise be able to. If I look at the typical coffee chats, if I look at the conversations at the water cooler, I've made an effort, and many across the organization have made an effort to recreate that and host small little intimate discussions on Zoom, Teams, or whatever other platform. So I believe that there's really a silver lining. As to the new office, again, a big adjustment. I'm working from home, and I continue to work from home at the moment. I had my office actually next to the kitchen. And early on in the pandemic, the family, and you talked about my wife and our 3 kids, decided that was just unbearable. So they've moved me up to the attic. And if you hear a little bit of an echo in the background, that's my new office. And that's working out of the attic and adjusting to clearly what is a different and new life.
So let's dive a little bit into some of the issues that are facing our industry today. And clearly, face-to-face interactions between pharma and their customers have dropped overnight due to the COVID-19 pandemic. But that doesn't mean that HCPs have stopped looking for information. They still rely very heavily on pharma companies in order to provide that information. So, Sebastian, can you help us understand, can you reflect a little bit on how Bayer Pharma adapted to this situation? What are some of the learnings, opportunities, maybe some examples of what you did over the last 6 months that you can share with our audience?
Sure. As I reflect on the last couple of months, there's really 2 big learnings. The first learning is just the power of purpose. We, as in our company, our purpose is health for all, hunger for none. And our contributions to society, the dependence on companies such as ours has obviously been incredible over the last couple of months. So the singular focus on our purpose, the energy that brought into the organization, the ability to really catalyze the power of all we do to our purpose has been incredible. So we've really focused on ensuring continued and robust product supply. We've focused on ensuring the health and safety of our employees and our co-workers, obviously. And then we've really focused and zeroed in on creating the most value for our customers. So the second big learning at this time from this past couple of months is how important customer obsession is. Because it's particularly during uncertain times that healthcare professionals are looking for ways to best serve their patients. They're looking to us to ease their life. And we've instituted right from the get-go very frequent touch points with our customers. We have focused on the many small little things that we can do to ease their life and to contribute to them being able to service their patients and serve their patients. So one concrete example that I'd like to share is in the area of women's healthcare, where a leading company in the field of intrauterine contraceptive systems. And historically, women required to visit their healthcare professional twice to get an intrauterine system. And our people have worked with obstetricians and gynecologists all across the country to help turn that into a single office visit. And with that, really ease the burden of physical presence in the physician practices. And that's just a small example of work we have done to contribute to our customers in easing their life in very tangible ways.
That's amazing. It must have been quite an effort to also mobilize your entire team to get that done. So maybe I'll pivot to Brian. Brian, you came in as a new colleague during these times. And on the one hand, obviously, you're looking at Bayer's pandemic response as part of the organization. So you had a ringside view, but you also had the benefit of actually looking at it from the outside, given that you knew. So what were your observations on Bayer's pandemic response?
Sure. What was interesting is it actually factored into my decision-making process in the interview, as I went through kind of the interview stages, because I had that ability to witness how Bayer was responding to the pandemic crisis in those early days of March and April. And what I saw, frankly, was really encouraging. I saw an organization really taking the bold steps to make tough business decisions. I think Bayer was one of the very first to say that we're going to take our sales representatives out of the field, even before there were formal restrictions across the country in place. They said, we need to do the right thing for our employees. We need to do the right thing for our customers and their patients. And witnessing that from afar, seeing those bold steps, it was really encouraging to me. This is an organization that has a lot of integrity that I would welcome the opportunity to be a part of. And then I don't even know, Sebastian, if you know this, if we've talked about this, but I actually watched Sebastian speak at a similar virtual conference and got to hear some of his remarks. And that certainly added to the process of evaluation. And I got to hear him share how Bayer was responding, and it further kind of cemented in my mind the impressions I had of Bayer and the decision to make the leap and join this team. So. And I can only say that in the almost 3 months that I've been a part of this organization, all of those preconceptions that I formed during that process, they've all borne out. I mean, they were all highly accurate and only continue to be reinforced every day.
Fantastic. And so, and getting into the mandate that you have, right, to set up a digital team, etc. What in your mind would an ideal or a good digital team look like? So, can you tell us a little bit about your learnings setting up a digital team, both from your time at Biogen and now as you're trying to do this? Sure.
Yeah, so I really think there are 4 components to a successful digital team. So I'll kind of step through each of those. So number 1, I think you need to have a portion of that team that is embedded with your brand teams or your franchise teams. You really need to have that close business partnership with the P&L holding functions of the organization, because digital does not exist in a silo. Digital does not exist solely for the purpose of doing digital. Digital exists for the purpose of driving business results, engaging with customers, driving better education of healthcare professionals, patients, payers, and ultimately contributing to health outcomes. So I think where that starts is you need to have a digital subject matter expert sitting side by side with your marketing, your sales, your medical, and your market access leaders as an integrated part of a brand team in order to translate your overall brand and customer strategies into real world digital engagement that is going to meet the needs, and digital solutions that are going to meet the needs of the business and of the customer. So that would be the first component. The second component is what I'll call insight-driven design. And this is going to be kind of a broad topic, but insight-driven design, what I mean by that is both the design of customer engagement or of campaigns. So how do you know the what and the when of how to engage with a customer in a digital channel? And can you use insights, data that tells you this is the right tactic to use, this is the right channel to use, this is the right time to execute this tactic, and use those insights to guide how you actually define that engagement plan. The second aspect of insight-driven design is also the experience design. If you're going to execute a tactic through the right channel at the right time, it also needs to be a really compelling experience. And I think too often in our industry, we let other third parties, or we let so-called experts tell us what a good experience is, instead of turning to the real experts, which is our customers, and all of the data we have about how our customers actually interact with us. Those are the things that we should let drive what a good experience looks like. So when I say insight-driven design, it's both the campaign design as well as the experience design, and it needs to be grounded in all of the insight generation and in actually talking to our customers to learn what is going to resonate with them, what matters to them, and then use that to really guide how we shape up our digital activities. So that would be the second piece. The third piece is really about having agile and robust operations. Because the first two pieces, it's all well and good to design the best campaign or the best experiences, and it's great to have trusted business partnerships with your brand teams. But ultimately, if you can't execute on it, you don't have a leg to stand on in terms of the credibility of a function that can actually bring to life all of these things that you're drawing up. It really just ends up existing in PowerPoint instead of existing in the real world, actually delivering value to customers and addressing the beliefs and behaviors of all of our different constituents. So that piece of the agile and robust operations, it means you need to be able to operate technology at the speed of business. You can't operate technology at the speed of a ticketing queue, right? You have to operate at the speed of, what insight do we have today? How do I translate that insight into an experience? How do I execute that experience through the right channel at the right time as quickly as possible? So those are the first three pieces. And I would say those three pieces, the embedded with the brands, the insight-driven design, and the agile, robust operations, I'd say those three pieces are required to deliver value today. If you do those three things well, you will deliver value in the current quarter, in the current year. But what you'll miss, and this is what the fourth piece gets to, is you won't necessarily be delivering value 1, 2, 3 years from now. And that's why the fourth aspect, I think, of a successful digital team needs to be a test and learn mindset towards innovation and experimentation. You really need to have a portion of that digital team that is thinking about the future of our customer expectations and the future modalities to engage with them, and is starting to experiment with those things. So to give you a concrete example of that, if we go back, say 10 years or so, 10 plus years, all of our digital experiences for the most part were designed from the perspective of people interacting with digital via a desktop interface on a computer, right? If you had just continued to focus solely on optimizing your desktop experiences through websites and emails and all of the different digital channels that exist, if you'd continued to just focus on that over the last 10 years up till now, you would have completely missed the moment in 2016 where mobile web traffic surpassed desktop traffic. And as that mobile shift has only continued, right? So I think it's critical, if I think about some of the teams I was a part of at that time, we started to focus on experimenting with responsive web design, and we started to focus on who are some of the emerging mobile players, so that when that shift happened, we were following where our customers' expectations were going. We were actually able to be ahead of that and be ready with the right sort of mobile experiences when most of our customers started interacting with us via a mobile device. So that would be the fourth piece. So that's the piece that's required to deliver value tomorrow. So to recap, you've got embedded with your brand teams. You've got your insight-driven design processes and capabilities. You've got agile, robust operations. And then lastly, you have a test and learn approach to innovation and to experimentation.
Thank you. You've really broken it down really well. Sebastian, I'd love to hear your comments about, pharma sales and customer engagement, but more importantly, also kind of open this dialogue up a little bit more, because one of the things that we've been looking at in terms of customer experience and customer engagement, so much of it is very much from a sales and marketing angle. and more we are beginning to see an elevation of the role of medical affairs as a whole, medical science liaisons as a whole. So if you can kind of touch upon the larger picture overall, not just from the when we look at customer engagement as a complete holistic kind of entity, how do you see this playing out from a business leader's point of view?
Sanjay, a couple thoughts. I mean, from a business leader's point of view, I firmly believe that we're looking at a tremendous acceleration of our digital transformation across the entire value chain. I mean, if I had to describe the progress of digital transformation in our industry a year ago, I would have described it as the race of the turtles. You know, we were racing. But at the end, in all transparency and honesty, we were, at least in comparison to other industries, still progressing at a very, very slow pace. So the speed with which we now need to transform across the value chain has accelerated dramatically. As I built on that, I think, and before looking at individual functional areas, I think what's really important is to do that with the right mindset. And Brian talked a minute ago about the test and learn mindset. You know, I would describe that as the willingness to learn, the willingness to embrace failure, the recognition that failure is part of progress. And that is culturally actually much easier said than done, because we're all wired to succeed. And with that, have a tendency to only shoot for incremental progress and aren't ready to really lean into these big leaps that are required. And that applies to organizations, but also very much applies to us as humans and individuals. And as a short aside, you know, if you look at, for example, my personal career, and you and I, we know one another since a long time. You will know that I actually started my career with a significant failure. I founded a startup company back in the late 90s, failed. And at the time, I can tell you that didn't feel great. In hindsight, it was a real accelerant to my own personal development. And in hindsight, it helped me then to progress from there in ways that I would have otherwise not been able to. So failure is really part of progress. If I look at the different parts of the value chain, clearly upskilling and transforming our field organization and initially our sales organization is critically important. It's equipping them with new skills. It's equipping them with technology. It's giving them the confidence that they can test, experiment, and learn and ultimately grow in their profession as we embark into this next normal. You asked specifically about the medical affairs organization. You know, in my mind, particularly the MSLs may ultimately become the tip of the spear. They may ultimately grow even further in their importance and their ability to engage with customers on their scientific questions. And equipping them with the right technology, with the right tools to have these conversations at any time from anywhere in settings that are most desired by our customers, because not all of our customers are the same. They have different needs, they have different demands. That's what digital transformation is for me. And that's not limited to the traditional sales organization. It goes much beyond that. So I hope that gave you at least a perspective of how I see it.
Absolutely it does. I just do want to kind of pick up on one of the points you talked about, you know, in reskilling, upskilling some of the field personnel. And in that context, you know, field reps in the industry, they've been very successful in the past. They've traditionally been successful in face-to-face interactions. But now it's different, right? And we feel that even right now when, you know, having a conversation with you over a video chat like this is different from being there in person. But how have you thought about creating an enabling environment within the organization so that the reps can start using their time more efficiently and stuff like that. Then I want to come to Brian after that about some of the learnings related to that.
So, in my mind, first, it's not either or. I don't think that we're looking at a world where it's only face-to-face interactions or only virtual interactions. I believe that we will have to flex between in-person and remote interactions depending on circumstances. And what I'm striving for is to essentially create an environment where we are able to get to our customers, to healthcare professionals, with the right message at the right time and in the right format. And that may be a face-to-face interaction at times. It may be a remote interaction. It may be the ability for them to engage with Google Home, for example, and deploy voice-guided interactions at their own leisure and without an actual person on the other side. And that has profound implications on the skills of our people, and it applies to the traditional sales organization as it does to our MSLs, and we talked about this earlier. It requires them to know what to deploy when and how to best engage in what circumstance. It requires substantially more data because at the end, and Brian talked about this before, our customers are telling us, and they may not be telling us sort of outright, but they're telling us through their behaviors what works best for them in what circumstance and at what time. And if you get more deliberate, and that's really what we focus on and are working on and have made great progress, if you get more deliberate, harnessing the power of that data and deploying it to guide us in what the next best action really is. And that's just not just a very narrow definition of next best action, but much broader. That's incredibly powerful. And it's then thirdly, the build up of the appropriate technology stack, because there's nothing worse than disconnected interactions that don't appear and are not seamless from the perspective of our customers. So we need to build at the back end a technology stack that allows us to have these seamless customer interactions. And we have, I'm really proud to share, we've made real good progress. We've focused, for example, recently on building out that technology stack, building out that approach to customer interactions in the field of oncology related to one of our most recent launches in the area of prostate cancer. And we've seen that it makes a real and tangible difference to our customers. We've made progress building out that technology in medical affairs. And are, for example, the first company to deploy Google Home and a voice-guided interaction opportunity and ability for physicians to rely on medical information or to retrieve medical information at their leisure, at their pace, and when and where they want. So it's these examples that ultimately create progress. It's these examples that generate real customer value and contribute to them being better physicians and serving their patients to an even greater extent.
Brian, I want to come back to you again. I mean, the last 6 months, right? We've been talking about digital transformation in the industry for a long time, right? But COVID seems to have precipitated the need to kind of just get it done. But how are you viewing the building out of a digital organization or the elevation of a digital organization now compared to what you had to do in your previous stint when you were building it out in Biogen, etc.? What are some of the learnings that you've seen during the COVID pandemic, so to speak?
Right. So I think that one of the most compelling takeaways from this pandemic situation is that as an industry, we have a reputation. Honestly, it's probably a well-deserved reputation for moving a bit slowly, right? Sebastian mentioned the race of the turtles, and that's the pace of our industry. And oftentimes we use the regulations as an excuse for why we operate at that pace. Well, I have seen tremendous acceleration of pace in the time of this pandemic. The systems, the capabilities, the business model shifts, the operating model shifts that have taken place. For example, companies, whether it's Bayer or other companies, have launched, new remote detailing capabilities, new digital tools for the field to be able to engage remotely, and they've done it in a matter of weeks. These are things that historically, in my experience, have taken years to get off the ground, and they were live in a matter of weeks. Content was reformatted and repurposed to a digital format in a matter of weeks and days. This is really exciting, and what it shows is that maybe that pace that we take for granted, that we have to operate so slowly in the pharma industry, maybe that's not actually true. Maybe we can actually operate a greater pace. I think the challenge we are now faced with is, instead of being in this firefighting or emergency mode to respond to the pandemic, how do we actually put the systems and the processes in place to make this just part of how we do business, and kind of ingrain that speed and that pace into a way of working that's sustainable for all of us. So I think that has been one of my biggest takeaways, and I actually we like to maybe chide Sebastian a bit on the fact that his favorite movie must be Top Gun, because his favorite word is speed. Sebastian absolutely has a need for speed, and so when I think about what I'm going to do at Bayer, what I'm in the midst of doing right now, I realize that speed is of the essence, and things that maybe took me 5 or 6 years to build out in my past experience, I need to build out in less than 2 years. And what I have around me in terms of the organization and the appetite, and frankly, what I think we've learned about our industry over the last 6 months, is I think it's entirely possible to move at that pace.
Great, and I hold that thought, because I'm going to come back to that a little bit, perhaps put you on the spot and put Sebastian on the spot as well a little bit. But before that, obviously the pandemic has accelerated digital connectedness, HCPs. In fact, what I hear across the board is that HCPs have become so much more comfortable engaging with these newer channels, which they were not earlier. But at the same time, that comes with the downside that they are now flooded with digital communication, right, from across the industry. And so, Sebastian, just a question to you. When you talk to your teams, and overall, when you think about it from Bayer as an organization, how do you think you would want to kind of make sure that you're coordinating the touch points to ensure that that customer experience is continuous and engaging across multiple points of contact, and doesn't become, just an inundation and one more thing that you as a pharmaceutical company is delivering, whereas there are another 50 in line doing the same thing?
I mean, to me, it actually, before talking technology, it's really important to get the culture right, and we talked about customer obsession earlier. At the end, it's not about us putting another 55 digital assets out there that the world really doesn't care about, because it doesn't create any incremental value for our customers. So to me, technology is a means to an end. It's a means to support our customers, and in this case, healthcare professionals, to be even better physicians, to be even stronger in serving the patients they serve. That's their purpose, and our job is to help them as best as we can in delivering against that purpose. So this notion of customer obsession, this notion of really reflecting on the value it creates to them. Is this just another email that will ultimately go to the junk folder because it serves our purpose but addresses none of their genuine needs? That's a reflection. That's a cultural piece that I believe is incredibly important at this. In addition, speak up and listen is a second cultural component that to me is incredibly important in the context of this digital transformation. And it's encouraging our field-based employees, our physicians, the folks we serve, to really speak up, but then most importantly for us to listen with intent. And the listening piece, and that may have changed, is no longer naturally only the regular conversations, but there's a lot of listening that happens through data. Because essentially, their behavior, what they do with the digital assets they see and receive from us, is telling us stories. It's telling us whether or not this actually creates value for them or doesn't, you know? So when I look at very simple metrics such as opening rates, click-through rates, and things like that, and they differ, obviously, physician by physician, therapeutic area by therapeutic area, geography by geography, that's telling us stories. And what we need to learn as organizations is to listen to these stories with intent. And the intent is not to ignore, the intent is to improve, and to improve ultimately on the value we create. And that then brings us to technology. It brings us to capabilities, data science and analytics capabilities. It brings us to fairly significant investments that we obviously need to undertake so that we're able to listen both in the analog world that we're all used to, as well as listen in the digital world and in the bits and bytes that tell us tremendous stories that we just need to learn to read.
No, that's helpful. In fact, in a way, you're talking to the point that Brian made earlier about having an insights-driven mindset built into the digital team. So that's perfectly resonant with that. So, Brian, as I said, I wanted to kind of put you on the spot a little bit, but not so much on the spot, right? One of the challenges that we've seen and we've heard from other digital leaders in the industry is that when a digital leader such as yourself comes in, companies and several other stakeholders expect almost like a fully baked, ready to use and scale kind of digital solution, pretty much from day one. Whereas in reality, it is a digital transformation, which is a journey, etc. And you mentioned that Sebastian, the one thing that he's known for is speed, right? So what has been your experience in dealing with that pressure? And to some extent, the question I have is, what would you need from Sebastian as a business leader? What would you look forward to from your business leaders to help you drive this change in Bayer and really deliver for the end customer?
It's a loaded question, Sanjay, and you give me an opportunity to really put Sebastian actually in the hot seat with my request here. But I think what it comes down to is digital can't be the flavor of the month. It can't be this year's shiny object to go chase. Digital needs to be a focus and an area of investment, of continuous improvement, and you need to have an organizational commitment to that. And as Sebastian said, kind of, the test and learn mindset and the embracing failure and learning and then moving forward and doing that quickly. I think that there needs to be an organizational appetite to not just run at the first failure and not just cut investment at the first failure. So my ask of Sebastian, is, are we all in? Are we all in for the long haul on this effort? And where I'll go next is, I actually don't love the term digital transformation. And there's a nice MIT Sloan Management Review article from a few years ago. It's titled "Digital Transformation is a Misnomer," because the term transformation implies that there is a beginning and an end to this quote unquote transformation. And the fact of the matter is, we are not going to live in any less of a digital world a year, 2 years, 3 years, 5 years, 10 years from now. So there is no end to this transformation, so to speak. So my ask of Sebastian is, are we all in, and are we all in to establish the continuously improving mechanisms to keep pace with innovation, keep pace with our customer expectations, keep pace with, or frankly, get in front of keeping pace and actually lead as an organization in this industry and push our whole industry forward in this space.
Wonderful. And so, Sebastian, the question comes to you, but I'd like to add on to that so that you get a chance to give back as well. So that on the one hand, are you all in, and our leaders like yourselves are all in? But at the same time, while it isn't a transformation, it isn't a start and a stop, there's obviously an expectation at the same time that whatever we invest in terms of capabilities and platforms, etc., will yield some kinds of results, both in terms of better patient outcomes as well as customer experiences, but also as a business. At the end of the day, we also all answerable to our shareholders. So how would you think about measuring progress at an enterprise level as to how you would assess that, yes, we have indeed made the progress that we promised ourselves?
Sanjay, before I answer your specific question, I would actually answer with a simple thought. And the thought is that we did not get here to get comfortable. We did not come here to get comfortable. We came here to get strong. And in my mind, that's very much a guiding thought as I look at this journey that we're on. You know, if we're seeking comfort, if we're seeking the next end state, we won't get very far, because we will look at this transformation indeed as a journey with a beginning and an end. And all we're trying is to get to that end as quickly as comfortable or as quickly as possible so that we can get comfortable again. And that to me is a big mistake, because to Brian's earlier point, we're living in a world that is continuously changing. The demands of our customers are continuously evolving. So at the end, what we're seeking is not comfort, but what we're seeking is strength. And that's a big difference in the approach and a big difference in what we want, or what we want to achieve. How do we measure progress? I think at the end, bottom line is that we will see progress and success in, for one, the results we achieve, and most importantly, in KPIs such as Net Promoter Score. You know, to what extent do we have physicians out there that are ready to support us and in fact recommend to their respective colleagues that they should work with us, that we're bringing value to them, that all these new channels, all these new activities that we're standing up really help them in the job they do. And that is the job of serving patients. So I think if that's what we drive, and if it's not us ending up counting how many emails we've sent, how many webinars we've hosted, and so on and so forth, that's all input. But ultimately, the value is measured in what this adds to the healthcare professionals, and ultimately whether or not it helps them to better serve the patients they serve. So it's that type of mindset that I feel is important as we drive progress and as we measure the results we create.
Yeah, we could go on and on. There's so many questions that keep popping up in my mind. We've spoken only about customer experiences as it relates to sales and marketing. There's a whole level of digital transformation or evolution, Brian, in the whole R&D space, but I guess that'll have to wait for another day. I'm going to pose one last question to both of you, because obviously this is a summit where we're talking about the digital leap going from X to 10X. So how does that digital space in pharma evolve over the next few years? What does it mean to be 10X? So Brian, maybe you can take a stab at that to begin with.
Sure. Thanks, Sanjay. And to me, 10X in digital isn't just about digital marketing or digital customer engagement. It even speaks to what you're talking about, opportunity in R&D and beyond. How do we as a pharma company, how do we as a pharma industry take ourselves to the next level of evolving our value proposition to our customers? And how do we actually become more digital businesses? How do we develop the types of services and solutions and business models that complement our molecule-based R&D processes? So to me, that is what 10X in pharma looks like. It's pharma actually becoming digital businesses, or embracing digital innovation in our actual core product set, beyond just how we interact with our customers. And frankly, I see Bayer making those moves, putting things in place to be able to be that type of company, and that was what attracted me to join the team here. So I'm excited for the days ahead.
Wonderful. And Sebastian, same question to you. What does it mean to make that digital leap to 10X? And I know we've touched upon a lot of those, but if you had to leave some parting thoughts from the point of view of that digital leap within pharma? I would love to hear those.
I would leave the audience, or want to leave the audience, with a quote actually from Abraham Lincoln, and you will be surprised with a Lincoln quote in the context of digital transformation. But the quote I would want to leave the audience with is, don't predict the future, choose it. And in my mind, that's exactly what the journey we're on is all about. We can sit here and predict the future, but it ain't gonna change a thing. What's much more important from my perspective is to start choosing our future, is to start creating the future we believe in. Failure will be part of that. Failure is ultimately part of progress. What matters is for us to roll up our sleeves, to actually engage in this transformation and recognize that it is a tremendous opportunity to bring greater value to our customers, to help, at least in a commercial space, serve them with the right messages at the right time through the right channels, and really enable them to serve their patients better. And that's the purpose of our industry. That's the value we create. So choosing our future, creating our future, is the tremendous opportunity I see, and is actually liberating and is fun. So that's the parting thoughts I would want to leave the audience with.
Really well said. And having known you, I know that this is something that you genuinely believe in. It's something that you wear on your sleeve every day. So firstly, obviously, the chat from my perspective was really fascinating. I'm sure our audience found it extremely useful. So thank you. And thank you, Sebastian. At this stage, I know you need to drop off, and we will have some more time with Brian. So therefore, I'd like to bring the audience in at this point. We have some questions that have popped up in the chat window for Brian, and those are things that I'd like to pose to you now. Thank you again, bud.
Thank you, Sanjay.
Thank you.
You're welcome. Well, there's been a deluge of questions, Brian, into the chat window, and I can't even keep up with how fast they're going. So unless I do a rapid fire round, I will never be able to get through those. But nevertheless, I apologize to those whose questions will not get answered. I'm trying to pose a few to Brian. Let's see if we can get 3 or 4 in the time that we have. So here's the first question for you, Brian. It's interesting. In your points for success about standing up a digital capability, you described having a digital SME sitting within your brand teams. So it sounds like SME is a member of your team. But do you see a point in the future at which that expertise transfers and it's just what the brand marketers do, and that's what becomes their job, and not something that's supplemented from a centralized digital team?
Yeah, so Sanjay, I think that's a great question. Honestly, it's a question that I've gotten for the last 10 years in these types of roles. So I think the short answer is this. Those roles with the digital expertise and the digital expertise sitting centrally within a team, I don't think that the need for a digital subject matter expert goes away anytime soon. I think that the question about, as marketing teams get more digitally savvy, do you need digital subject matter experts? And I would argue that it is impossible for even me, as I would consider myself a digital generalist. I am not a deep expert in artificial intelligence or machine learning. I'm not a deep expert in programmatic media. There are digital disciplines where you absolutely need a subject matter expert, and I don't believe that subject matter expert is a marketer. The more digital generalist, as we upskill marketers and marketers in pharma become more digitally savvy, I think that the role of the digital subject matter expert embedded in the brand starts to move ahead of the curve a bit. That role starts to be focused more on the innovation and the things that are coming 1 to 2 years down the road. And that role shifts from supporting the marketing team with digital marketing, which should ultimately become the competency of the marketing team, and moves towards digital services, digital solutions, some of those partnerships with medical, R&D, market access, et cetera. So that would be my answer, is that there's always going to be a need for subject matter expertise in the deep disciplines, but some of those more generalist things, as we upskill marketers to be better digital marketers, the digital subject matter experts move to more of the future services and solutions.
Yeah, really well said. I guess what you're saying, therefore, is that this whole digital transformation really is a maturity journey, and that journey never stops. You keep pushing the envelope to see what more you can do. But let's try and squeeze in another question here, and this is actually moving away from the digital capability, but more about operations, and where you talked about robust operations, and you said that that makes sense for a large pharmaceutical company. Obviously, the question really is that robust operations make sense for a large pharma company, but what recommendations would you have for smaller companies who don't necessarily have the access to the infrastructure that maybe a larger company may have?
Well, I think, Sanjay, the remarkable thing about the environment we're in right now is the cost of entry has decreased so much with the advent of new technology solutions and software as a service. So I would argue that for a smaller organization, you can still have robust operations. It just doesn't mean that your robust operations are sitting on a very expensive and complicated technology stack. Your robust operations are sitting on top of self-service software as a service capabilities. So I think in those cases where you have fewer resources, you have fewer people, the expectation is just that the smaller company, the smaller teams are being more hands-on, right? You need marketers that can actually log into a web content management system or a marketing automation tool and configure their own tactics and execute their own tactics, rather than relying on large, complex, potentially outsourced operations teams to do that at tremendous scale. So I actually think that it is not an excuse to not have robust operations if you're a small organization. I just think it puts the onus on you to be a little bit more nimble and a little bit more hands-on with the resources that you do have.
So, I'm just going to be a corollary to that question. Therefore, do you think that we should basically be thinking also about perhaps Uberizing the model, so to speak, so that ultimately it becomes, digital operations in a box available on demand to the marketer. So the marketer is then still thinking about strategy as well as customer experience, but has all the tools that are needed to drive a meaningful customer experience.
And to a degree, I think we're already seeing that. I think we're already seeing a lot of these large software players. So, the Salesforces and Adobes of the world, we're seeing them move towards more self-service tools and solutions. We're seeing them create better user experiences for their software. So I think that we're absolutely seeing that shift. I think the only caution or word of watch out there is, as soon as you say it's kind of a one-stop shop, black box, handles all your digital solution, based on the nature of digital, as soon as that's defined, it's out of date a month later or 2 months later or 3 months later. So how do you make sure that what you put in that box is going to continue to meet the needs? So that would be the one caution with that. But I think increasingly the types of tools and technology available to us are making these types of things possible.
Great, that's really helpful. Okay, next question then. And you spoke about having an insights-driven approach, building an insights-driven organization. Which functions do you think, or in your opinion, would create additional value if they were working together more closely to drive this transformation?
Yeah, I love that question, because this really isn't just about marketing. I think so often with digital, we start with marketing. And I think that's an appropriate place to start. But where digital, I mentioned this kind of in my comments, Sebastian mentioned it when he talked about some of the work we've done within the medical organization at Bayer, where I think we really take digital to 10x is when the digital SMEs, if you will, start to really partner closely with the R&D organization, the medical organization, the market access organization. And we start to think not just about marketing tactics, but we start to think about digital services and solutions and really changing the business model of the organization and really thinking about how do we harness the power of digital to drive better health outcomes, which in many cases is an R&D or a medical or a market access challenge more so than a marketing challenge. So I think there's huge opportunities for those functions to partner more closely. And I think I've already had some experience and seen successful partnerships between those types of organizations and sub-functions. And that's something that we're absolutely working on and driving forward with at Bear.
I guess it's the whole concept of becoming much more agile in the way you approach things. Great. All right. I think we're doing pretty well in terms of getting through at least some of the questions. There are, of course, zillions. We won't get through them all. But here is another one where it talks about, in the current environment, beyond the email, what else have you seen working for, reaching HCPs virtually? These providers are probably buried in email at this point of time. So what innovative things have you seen work beyond just calls and emails? Is there something else that has actually captured the imagination?
Yeah, so I think email does get a bad name, right? And I think that's because of our experiences as consumers subscribing to a bunch of email lists and having a hard time keeping up with our own personal emails. That said, I still see email work. I still see email generate substantial ROI and be one of the easiest channels to activate. I think you just have to be sensitive to the timing and sensitive to the message you're sending and making sure you're sending an email that's actually relevant and something that a customer would actually want to open and engage with. And you have to monitor your unsubscribe rates, and you have to honor, when a customer tells you, I don't want to be on the list anymore. But beyond email, I think there's a number of different channels and approaches, and I think that digital media in particular is getting far more sophisticated with respect to healthcare professional engagement. So not just the tried and true publishers in the space, the Medscapes of the world. Doximity has gotten far more advanced over the last several years. So there's a number of publishers in the space that I think are valuable partners. And it really depends on the particular healthcare professional that you want to communicate with in terms of which platform resonates with them. But then I think that programmatic media has come a very far, has progressed quite dramatically since a few years back. And so, we think about programmatic usually in the context of consumer advertising in the US, but really programmatic targeting HCPs, it has come quite a long way. So I think those are some of the things that I've seen work. And I also think that it's not just about the advertising channels. It's also about, and this is where Sebastian mentioned as well, it's not just the face-to-face or the digital. It's about kind of combining the two. And can we have productive conversations with our top accounts about the types of digital services and solutions that would be useful to them? And then can we engage with them on those topics, right? Rather than just constantly pushing out an advertising message and trying to find our customers with an advertising message, how can we also partner with our customers on services and solutions in the digital space that make sense for their specific institutions, their specific practices?
So fast forward to end 21, maybe early 2022, hopefully by then. Vaccines have started to build herd immunity, and we are past this pandemic crisis. And hopefully, Brian, by then you're back to office, walking the hallways, having coffee conversations with people. But do you think that face-to-face interactions will return to be the predominant form of HCP interactions by then? Especially, pharma traditionally has been quite a herd in itself. So if one or two of the top pharma companies start doing that, returning to face-to-face interaction, do you think other companies will rapidly follow suit?
So I can't predict the future. I wish I could, but I can't predict the future. What I will say is I don't think the role of the sales rep goes away. It's not going away in this current environment. The role of the sales rep in this current environment has just shifted to engaging through new channels and using new modalities to engage with their customers that they used to go see in a face-to-face setting in the office. And now they're engaging with on a phone call, on a FaceTime, on a Viva Engage meeting, right? That's been the shift. So when we get to the point, knock on wood, hopefully sooner versus later, where this pandemic is in our rear view, I don't think we go back to exactly what the world felt like 10 months ago. I think that some things will go back to maybe a little bit more of a comfortable place, but I think that there will be mindset shifts around, oh, well, I feel a lot more comfortable with telehealth now, or I feel a lot more comfortable engaging more on my terms. And so in some sense, this pandemic and the types of digital capabilities and tools and modalities that it's enabled is, you know, in a sense, empowered all of us to feel like we can interact with, you know, other stakeholders in our lives on our own terms. We can interact over a virtual engagement on video instead of needing to go physically into a doctor's office to, you know, to interact with something related to our health. So I would say that, you know, when we quote unquote go back to normal, I don't think it'll look like the normal of 10 months ago. I still think there's a really critical role for the sales rep. And I think that role for the sales rep is going to be a blend of the in-person interactions that they were used to 10 months ago, along with some of the new ways that they're interacting that they're getting used to in this current environment.
Yeah, you know, I guess they will start becoming more multi-channel orchestrators of customers' experiences. I'm going to try and squeeze in one very quick question, and if you can just be, you know, quick in your answer. Is one of the things is, you know, there is a perception that when it comes to digital omni-channel customer experience and driving excellence in that the pharma industry may not necessarily have the level of experience and expertise required in order to be able to do that well enough, and therefore a radically fresh perspective, maybe from other industry sectors, e-commerce, retail, telecom needs to be brought in. So how can pharma pull in those best practices from other sectors while still retaining the nuances that are endemic to the sector itself?
Sure. So Sanjay, your last question is one that I'd probably spend the longest amount of time answering, but I'll give you the very short version of the answer is, we have so much pharma-specific talent within our organizations, right? Across marketing and sales and market access and medical and R&D. So I view the digital function as an opportunity to bring in outside of industry talent and perspectives, and really needs to represent that from other industries, because, you know, the teams will learn the pharma nuances. What they will have a harder time learning is all of the outside of industry digital best practice. So in my experience, I've had a lot of success looking to maybe similarly regulated industries, but ones that have moved faster with digital. I think financial services is a great example of an industry that has been a great talent feeder for me in building out some of my teams. I think you also see it with consumer products, you know, ones that are tangential to the type of interactions that we do in pharma. And so it's not as far of a leap, but they are industries that are much more advanced in digital. And then I think looking to third party, whether it's advertising agencies or service providers, you know, groups that have really strong talent that are making their living being ahead of the curve, looking to them to also be a source of talent for our industry. So that's how I'd answer that.
Great. Thank you so much, Brian. And, you know, again, as I said, we could go on and on about this, and maybe, you know, we all look forward to kind of meeting up with one another in person, but I want to thank you very much for your participation. I apologize if we haven't been able to get through to your question that you posted in your chat window, but I'm sure, like me, a lot of our audience would agree that this has been a really insightful session, really helpful. Thank you to you, Brian, and of course to Sebastian, who unfortunately couldn't be part of the Q&A session, but I'm, you know, I hope that this is a suitable kickoff to an Indegene Digital Summit, which looks to talk about the digital leap. So thank you all very much for participating and being such a captive audience. And at the same time, enjoy the rest of the summit, enjoy the rest of the day, but more importantly, stay safe. Thank you very much.
Thank you so much, Sanjay.